say is that there are different times and different questions and different reasons why we want to go abroad. Sometimes we want to learn a skill and come back. Sometimes there will be reasons of we want to seek a different kind of a lifestyle. Sometimes we simply seek to earn more money and come back. And for this we need to understand there will be different countries offering us different opportunities and different barriers. Thomas Friedman once said that world is flat, but unfortunately world is not flat for healthcare. Healthcare is guarded by licensing. That is the first barrier. Second barrier is language. And third barrier is healthcare systems of different countries. Now, let us start by looking at the first example. The first country that most doctors or most youngsters seek to go abroad is America. When we want to go to America, the first thing we need to understand is they don't directly take us as licensed doctors. Even if we have qualified in India, we have to pass a licensing exam called as US Medical Licensing Exam. Licensing exam is a concept which is new to us in India, but NMC is now working towards a licensing exam in India also, which is going to be called as NEXT. So let's see why this opportunity is there and why it exists. I want all of you to imagine the healthcare system in India. If you imagine the healthcare system in India, it will look like a pyramid where we have MBBS seats, and as compared to the MBBS seats, the seats in post-graduation will be lesser. We go up, the seats will be even less. We want to super specialize, the seats will be less. Now, if we imagine the healthcare system in America, it is going to be exact reverse. We are a developing country. They are like all debatable, but we consider them in traditional sense a developed world. So their pyramid is exact opposite. The number of graduate seats will be less. They have more residency positions, and when we come to fellowship positions, even higher. Now, if we imagine a country where you have more number of residency seats as compared to the graduate seats, what will happen? You have to fill up those seats with international medical graduates who are called as IMGs. So this is where the opportunity for going to America starts, that they need people to fill up the residency positions, which will not only be filled by doctors from India, they will also be filled from doctors all over the world. So when we compete for a US residency seat, we are not only competing with other Indian doctors, we are competing with doctors across the globe. And they take a licensing exam called as USMLE Step 1, Step 2 CK. Step 1 will be basic sciences, Step 2 CK will be more clinical sciences. Before COVID, they had a step called as Step 2 CS, which is based on clinical skills, which is no longer there. In COVID, they stopped it and they have not reintroduced it as of now. Now, I just want you to understand that a lot of times when we think of going abroad, we think with our own closed mindset and we think with our own ideas. Sometimes we don't consider the second barrier, which is the healthcare system of the country that we are going in. In America, it is as my career as educator in the last 2 decades, I have seen that there are some branches which are very difficult to match in America. For example, ophthalmology is almost impossible to get for a IMG because it's very sought after by their own graduates. Now, recently I met a student who said, "Sir, I want to do ophthalmology in America and I want to do it from the best college in America." ऐसा लग रहा है कि तू कह रहा है कि मैं शादी करूँगा लेकिन सिर्फ ऐश्वर्या राय से करूँगा, ऐसे में तो बात ही नहीं बनेगी। तो मैंने बोला थोड़ा ब्रॉड कर ले, शादी करूँगा खूबसूरत लड़की से करूँगा, चांसेस बढ़ जाएंगे। फिर मैंने उससे बोला अगर और ब्रॉड कर देंगे, शादी करूँगा लड़की से करूँगा और चांस बढ़ जाएंगे, अगर सिर्फ शादी करूँगा बोलेगा शायद बात और आसानी से बन जाए। So it's like this, we have to understand the healthcare system of the country that we are going in. Let me give you an example. When you go to UK is a different healthcare system from America. It is not the classic system that we in India practice. It is a system which is governed by GPs. So we need to find where we are going and what is it that we seek out of our life. Are you the kind of person who wants to super specialize, or want to go into a specific kind of intervention procedure or learn a specific skill, come back to India, you want to get licensed there? We have to find all those reasons and then work backwards onto it. I'll give you some specific tips. Like today, if you want to match into a residency in America, it is a very, very good idea during your medical school. If you have some rotation or some part of your medical school you spend in America as a clerkship or rotation, it adds to your resume a lot. But these are the kind of things that you would think when you have a clear why to it. Like suppose if you are going abroad means that I want to do a job, earn some money, come back. Then you would target a different country. There are countries like Saudi Arabia, Qatar and Kuwait, they would not require you to undergo a licensing exam per se. But there would be countries like Canada where they would have an exam, but the chances of getting into a healthcare related job is very uphill. So you have to find where are the best opportunities for you, what is it that you seek out of it, and are you able to check boxes that they seek in you. It is not just what we seek, it is also what they seek in you as a doctor. I know it's a very broad topic that I've been given to talk about career opportunities abroad. Abroad is a very big term, but these are the kind of circle that you need to draw. Barrier number 1, licensing exams. Barrier number 2, language. Like I know a lot of doctors, a lot of youngsters are going nowadays to Germany, but then you have to have German language proficiency. Language. Third is healthcare system of that country. If I'm not able to understand what they need, it would not work out. Like when I graduated, at that time, a lot of my colleagues were going to UK for jobs, and around 2005, the jobs almost dried up in UK. So even if you pass a licensing exam at a stage where the political structure is not allowing jobs, you will not get anything out of it. So when we say opportunities abroad, they are like massive opportunities abroad. World is big, but it is not flat when it comes to healthcare. And my final words before I ask the next speaker to take on is, when we say opportunities abroad, it not only means going abroad and working there. It also means, can we bring those opportunities back to your country? We have seen in radiology startups and organizations working in tele-imaging. I know of radiologists who qualified abroad, came back to India, took their work back to India also. So it's like when we say abroad, it not just means physical translocation into another country. It is also, we are living in a digital world. It also means, can we leverage technology and the knowledge that we have and bring that work back to our country. I thank the organizers for having me here, and thanks to Dr. Darmia. Thank you.